As you have all heard me say at the beginning of the COVID-19 pandemic, this fight is about protecting lives, but also livelihoods. And for today's COVID-19 update, I'd like to start by sharing the great progress Georgia is making in protecting the lives of our citizens from this virus. First, our new cases reported are down 64% from our peak on July 24th. And according to the Wall Street Journal and Johns Hopkins University, Georgia is now 34th in new cases reported per 100,000 residents. Currently, our confirmed hospitalizations for COVID patients stands at 1,287. That's down 60% from our peak. COVID positive patients are now only 8.8% of our total people in Georgia hospitals, which is great news. Our 2-week average of percent positive tests now stands at 5.9% statewide. On August 7th, 2 months ago, it was double that at 11.9%. So we've made great progress in that important metric. Cobb, Fulton, and DeKalb counties are now all under 4% positive for the 2-week test positivity rate. When it comes to long-term care facilities and nursing homes, the state of Georgia has spared no expense, as you well know. We've sent supplies, provided testing materials, deployed infection control teams, and obviously been shipping out a lot of critical PPE supplies. As of September 15th, 172 of our nursing homes were in the red zone, meaning that their county had a percent positive over 10%. Today, that number is 49 nursing homes. That is a 71% decrease in the last 3 weeks. The number of nursing homes in the green zone with less than 5% positive in their county went from 19 homes to 69 facilities as of today. That is a 263% increase in nursing homes that are now in the green zone for test positivity in their county. And last week, as you know, we announced a $78 million in reimbursement funds to nursing homes to ensure they are able to meet the federal testing requirements, in addition to another $35 million in continued staffing assistance to these facilities through the end of 2020. We've been able to accomplish these significant improvements because Georgians have bought into what Dr. Toomey and I have asked them to do. And we're very appreciative of that. We said it on fly-arounds. We've said it standing outside hospitals. We've done it here at the Capitol, at the airport, and in communities all across our state. And we said that we needed Georgians to be part of the solution and not part of the problem. And I'm very thankful and very proud of the fact that Georgians have stepped up to the plate and have done the right thing. The key is for us now to keep doing this. We cannot take our foot off the gas. Despite what some in the media have chosen to ignore, we've been able to keep businesses open. Most kids have been able to return to schools, and people have been able to go about their lives in a smart, responsible way. But that is only sustainable if we continue to do our part moving forward. That's why Dr. Toomey and I rolled out 4 things for fall. Wear a mask, wash your distance, wash your hands, and follow the guidance Dr. Toomey and her team continue to put out there. If we all commit to doing the right thing, I'm confident that we will continue to move in the right direction in our fight against COVID-19. We've also made great progress in protecting livelihoods. Georgia's economy, as you know, was firing on all cylinders before the pandemic. And it's a testament to the grit and determination of small business owners, entrepreneurs, and hardworking Georgians in every corner of our state that we are breaking economic records even during a pandemic. From July 1st to September 30th of this year, Georgia has announced the creation of over 10,000 jobs, generating over $371 billion in investment on projects that the Georgia Department of Economic Development that has been working on. That is a 50% increase in new jobs created and an 85% increase in new investments compared to the same time a year ago. Our unemployment rate, thankfully, is below the national average. We've maintained our AAA bond rating. State revenues continue to be strong, and we were again named the #1 state for business for the 7th year in a row. We have worked hard to protect people and their paychecks, and yes, we can do both. In closing, I'd again like to thank everyone and ask them to do 3 things. First, join us today in continuing to do 4 things for fall. Wear a mask, wash your distance, wash your hands, and follow public health guidance. Number 2, get your flu shot early. Number 3, fill out your census form today by going to my2020census.gov. As we've mentioned previously, over the last many months, this is very important for Georgians to do this and do it today, if at all possible, at my2020census.gov. And with that, I'm going to now turn it over to Dr. Toomey, and she'll give you an update, and then I'll come back up for some questions. Thank you.
Thank you so much, Governor. Good to be here today. Really, Governor Kemp, I think, has become an epidemiologist because he's laid out all the issues as I would have done. I think the one thing I do want to emphasize is the importance not only of these, what I'm calling the 4 pillars of prevention, that the 4 things we can do for fall: wear a mask, socially distance, wash your hands, follow the guidance. But that 5th thing is get a flu shot. Flu, never has it been more important to get a flu shot than this year. We realize that people sometimes don't think a flu shot is effective, or afraid to get it, or just don't bother. This is particularly important this year. We're trying to prevent twindemics of COVID plus influenza, which could be devastating. We don't know what the presence of influenza may do to a COVID infection. But at the same time, flu itself can be very deadly and can lead to hospitalizations that could fill up our hospitals and then not have capacity for COVID patients when and if that increase may occur. And so we're really saying this is an extremely important thing to do, actually as part of our COVID response. Get that flu shot. We have them available through public health as well as through many of our other community partners. You'll see that we're really emphasizing that children are particularly at risk, as well as the elderly and everybody else in between, because of the potential for spread, for example, in the workplace. And so we encourage everyone over 6 months of age to get a flu shot. And there's a special kind of senior flu vaccine that has more antigen to boost the immune system for seniors as well. And these are available throughout the state. Public health right now has to date over 307,000 doses of flu vaccine that we have already gotten out throughout the state to all of our health districts. And we'll get over 400,000 additional doses throughout the state, so statewide. We have these available at our health departments. The other thing that I'm really excited about is that almost all of our health departments are doing drive-through flu clinics. And this is particularly important this year because many people were thinking, I don't want to get a flu shot because I don't want to go into a clinic where I might be exposed to COVID. Well, the drive-through allows you to get that shot in your car. And for example, in the Dalton area alone, they did more than 1,700 flu vaccines in drive-throughs. And so they're doing hundreds a day in their drive-through clinics. So we're really very, very proud of the work that we're doing statewide to really focus on the flu vaccine this year is really one of the most important prevention efforts we can do as part of our comprehensive COVID response. I want to just also mention, because I think this has come up, just about our website and our reporting. We will be putting probable cases, this is not of flu, but now of COVID, on our website probably by next week. and these are antigen test positivity. I know this has come up. I've gotten many questions about this to our communications people. The probable cases are antigen positive cases. We respond to them as we do a PCR, or the kind of test that we do at our 188 SPOCs, or public health test sites throughout the state. So we are still continuing to test, still encouraging people to get tested at our sites, but are also recognizing that many people choose to go to an urgent care center or some other place where they can get these rapid antigen tests. You may have noticed that there's a little blip in percent positives that probably reflects some of the antigen tests being eventually added to our system. We haven't quite worked out that electronic transfer of those tests, and are working very closely with many of the urgent care centers, so that happens automatically and those tests get reported rather than requiring these clinics to enter those by hand. But you'll be seeing those added not as part of the total positives, but as a separate probable case category. So that's a coming attraction on our website as well. And so I just wanted to proactively mention that to you because it may come up. But again, to close, everyone from 6 months to 100 needs to get a flu shot, and please, this is the year to do it, and reach out to public health or many of our other private partners to do so. Thanks so much. Oh, and one other thing to note, when you do get your flu shot, take a picture and forward it to me. I think you have my email address, and we'll get you on our social media campaign. This is part of our social media campaign, and that would be really great to show everybody throughout the state actually getting their flu shot and setting an example this year for this COVID prevention effort that we're doing. Thank you.